We spoke a little bit earlier about people who might use substances as a way of self-medicating for an undiagnosed or unsuccessfully treated mental illness. And we have a name for that in the field. We call it a concurrent disorder whenever a person has a combination of a mental illness and a substance use problem, particularly a dependency. Sometimes you may hear people refer to this as a co-occurring disorder or a comorbid disorder. Essentially, they're the same thing for our purposes. So the consumer has both a mental illness and a substance abuse diagnosis. Now, sometimes the diagnosis of the underlying cause is the mental health issue. In other words, for example, a person might have a history of depression that went undiagnosed, and then the person began to use, let's say, alcohol as a way of treating it and became addicted to alcohol. We would describe the addiction as being secondary to the depression, and the depression would be the primary or first disorder. So when that happens, we refer to that as a time when a person is self-medicating. They're using the substance to treat the underlying mental health. But in some cases, the opposite process may happen. A person may actually have a substance use issue first, and because of the chronic and sustained use of that substance, they may eventually cause themselves another mental illness, such as psychosis or dementia. Concurrency is a very common problem. We're going to learn later on that approximately anywhere from 20%, and in some cases people believe the number is higher, of people who have addiction issues may also have other issues related to mental health. But it is a very challenging thing to diagnose and to treat. Let's talk about why. There are a variety of challenges that can occur when supporting an individual who has a drug or alcohol dependency, and those challenges become even higher when an individual has a concurrent disorder. It becomes very difficult to assess the underlying causes of the disorder. Is there an underlying mental illness, or are there other issues such as a lack of social skills, coping skills, or low self-esteem, or any combination of those things? When we're ready to support somebody and provide them with treatment, it can be very difficult to amass the necessary resources and assets, especially at the times when we want them. In the old days, we used to support people using what's more of a serial approach. In other words, we would do one thing and then after that another thing and another thing. We might provide them, for example, with detoxification. Then we would help them to get counseling so they would develop some coping skills. Then perhaps we would reacquaint them with their families, help them to get a job, help them to develop life skills. What we're understanding more and more is that it's better to take a more comprehensive approach and provide people with many of those assets that they need all at the same time. Address the underlying mental health needs, give people counseling, help them connect with family all at the same time. Now that can be very difficult to do. It's a great theory, but because of things like sometimes a shortage of resources that are available publicly, or because of difficulties people have in terms of connecting with friends or family, it can be difficult to get both formal and informal resources for people when we expect or would like to have them. Denial is literally a criteria of the diagnosis of a dependency. And so people who have an addiction or a dependency literally have a disbelief that they actually are experiencing dependency initially. And that's one of the most difficult things to overcome, getting a person to be what we call contemplative, or to be accepting of the idea that they have a problem in the first place, and then everything else can be possible. And you probably have seen television programs such as Intervention that are designed to sort of teach one way that this is done. In truth, interventions are becoming less and less in vogue because they can actually have the opposite effect. They can often make people feel betrayed and less likely to stay connected to the healthy influences that they have. Something that we see happening more and more nowadays is the harm reduction model, where people might come into a facility such as a safe injection site or a homeless facility, and they're allowed to come into that facility without a whole lot of rules or a whole lot of encumbrances. The idea being that we gradually have that person come in, begin to feel more and more comfortable, and develop relationships with the staff people in those locations, who can then, as that trust is beginning to be built, start to help that person connect up with other resources that they need. Instead of sort of using a flooding technique of an intervention, now we're using a gradual exposure technique, and it tends to be more successful. Of course, we know that people have a great deal of stigma, that there's a great deal of community fear and stigma associated with the idea of addiction. And so, in order to help people who have that issue, it's difficult sometimes to overcome some of those preconceived notions that may be out there. For example, helping a person to find an apartment might be a difficult thing if they have a history of drug abuse. Helping a person to find a job, similarly. So, these can be very big things in terms of real impacts for an addict in recovery. And we need to understand that people, when they go through recovery, will experience speed bumps or significant impacts in their life. For example, they may reconnect with somebody, a spouse, a child, a family member, but that relationship will probably have some hurts and some problems along the way. That person may, for example, feel quite good about their sobriety, but then when they get out into the real world, find that some of the challenges they face are a little more difficult than they might have envisioned. And sometimes people are not as prepared as they thought. They haven't developed that coping system, that resiliency internally and externally fully. And they may therefore encounter problems or issues that arise, for example, something like a death, before they're fully capable. And so that can make it difficult for the person. And as a result, they might have what we call relapses or slips. And again, our thinking around this is changing to some extent. It wasn't very long ago that treatment facilities would literally evict people who used a substance during the time that they were in treatment. More and more facilities are taking a different view of this. While they certainly aren't welcoming or accepting slips as everyday business, they are understanding that people don't usually go from being a drug user one day to never using drugs again that dramatically. And instead, they're trying to create more distance and time between the types of usages that people have. And in fact, if they do relapse and try a drug again, the idea is to get that person back into care as quickly as possible instead of having them restart the whole cycle. One of the predicates of this course is that we want people to walk away thinking about the role they might play in making their community a better place in terms of things like substance dependency and mental illness. We want to go back to a time when, instead of worrying always about things being taken care of by external agencies, where neighbors and families pitched in to try and help one another and provide some sometimes informal supports. So we're going to wrap up this portion about drug dependency and about concurrent disorders by asking you to think about what role you might play in helping to deal with these issues. And we want you to think not just in terms of your professional life, although that's clearly important, but also thinking about what you can do in your own home, your own family, and within your own neighborhood to answer these two questions. Number one, what can you do to prevent substance abuse in your community? And number two, what can you do to promote wellness for substance-dependent people in your community? So again, take a moment and ask yourself those questions from a personal perspective, not just a professional perspective. And by all means, think about what you might do with your own children, within your own neighborhood, and so forth. And then again, look online and see what comments others have given and see if they inspire you to think of new things. Take approximately 5 minutes to answer the questions and 5 more to review the answers that are there. And we haven't talked about this for a little while, but if you see something in somebody else's journal that you think is a great idea or that's a subject for debate, then by all means, respond.